Yeah, thank you for that. So we were in Tampa last weekend teaching. So what Buck doesn't tell you is that now, see, there's probably 5 training schools. So if a physician or a nurse practitioner or a PA, somebody that wants to get certified in the program, they have to undergo a pretty rigorous training, a day and a half of training where they go through 700 slides. They have to take a test. They're then taught the surgical techniques to do this for their patients. It's an extra certification above and beyond their already good certification. So we have about 5 training schools, 3 main ones: Tampa, Southern California, and Irving, Texas. I teach at Tampa and in Southern California, and then occasionally we were up in New Jersey, Chicago, yeah, and there's some other places as well. So they asked me to join faculty a couple of years ago, so that's kind of fun. We get to travel around and do that, but I don't say that to impress you, but it just appears that, you know, they say the 2 most important days in a person's life are, number 1, the day you were born, and number 2, the day you find out why. And I think that's what's happened to me for BioTE. I think I found out why. I mean, after everything I've finally done, things just resonate. It just seems to make sense, but that's not important for you here tonight. So my goal here for you tonight would be to have you maybe leave a little more educated than when you came. Is that a fair goal? I mean, I don't want it to be a waste of your time. I want you to leave here feeling you were enriched, you left with something that made a difference. Whether or not you decide to participate is completely up to you. And so to do that, I want to kind of open up our eyes just a little bit. And so I want this to be interactive. We're going to have some fun here. We're going to go back and forth a little bit. And so if I ask a question, try and answer it. And it's more fun if you interact and stuff. But I learned a long time ago. Well, before I get to that, Buck covered a little bit about my medical background. And so I was one of these persons who, after serving in the military, do I have any fellow veterans in the audience, by the way? Am I the only veteran? Okay, well, I always like to thank my veterans who have done service. And so full-time active duty flight surgeon, I was doing emergency medicine on the side as well. And then I started realizing by working in the ER that we're seeing, I mean, you know, what goes to the ER is like what? Broken bones and car crashes and strokes and heart attacks and babies that need delivered on an emergent basis, as well as, you know, cut fingers, sprained ankles, all that kind of stuff. And I realized that for chronic illnesses, we didn't really have a lot of good treatments in America for chronic illnesses. And chronic illnesses are what? They're like diabetes, blood pressure, heart attacks, osteoporosis, right? Some of us know people that have those kind of ailments. They kind of have to learn to live with those ailments. Well, our medical system doesn't really effectively teach how to really effectively deal with it. We manage those diseases, but we're not really taught or trained how to maybe look for the root cause of the problem. And so instead, we offer fixes and cures in the form of Band-Aids, in the form of pills or surgery to kind of manage the illness. We call it the disease management. I'll talk about that shortly. Instead, when I realized that, I said, you know what about if we just peel back the layers of the onion a little bit? Let's look for the root cause of the problem. And if we can identify the root cause of the problem and then effectively tackle it there, now we've effected what I call healing. Now, once we're healing, we reduce or eliminate the need for the fix and the cure. Does that make sense? To me, that just makes sense. Our system just doesn't really teach us to do that. And so that's what we're going to cover here tonight. And when I was first learning some of this, I really was kind of cautious, or maybe, I don't like the word skeptical, because it's kind of a negative term, but I was cautious. And I run into cautious, maybe even skeptical colleagues all the time. And so I've learned that maybe things aren't always as they appear. Have you ever been in a situation where maybe you realize, hey, wait a minute, when you first realized one thing, and then you realize later, hey, wait a minute, that's not at all what I thought it was. Has it ever happened to you? That kind of was really drilled home to me probably a couple years back. My daughter has a friend who works at a really high-end restaurant in Wichita. And then back before COVID, we had Broadway productions. Wichita's about 400,000 or 500,000 people, you know. And so when the Broadway production Wicked came to town, then the director of the play each night would come in to this nice high-end restaurant and order dinner after the production was over. And then she would go back, and the next day she kept doing it every night. Well, one of Ashley's friends, his name is Isaac, and Isaac had a friend waiter, and he would go up and wait on her, and every night she'd order the same thing. And the restaurant had a policy that says, hey, if any of the customers don't touch an item of their food, you're welcome to take it back to the kitchen and off to the side, help yourself to it as long as they don't touch it. And this friend of Isaac's was raised in a very frugal environment like I was, and that is, you know, you don't waste food. There's starving kids in Africa, you know, that kind of thing. So every night she would order the scallop. She wouldn't touch the scallop, but she'd eat all the side dishes around it, the garnish, stuff like that. And so every night, Isaac's friend would take it back to the kitchen and help himself to the scallop. And so Isaac's watching all this take place for the first 4 nights. By the 5th night, his curiosity has got the best of him. And he's sitting here thinking, oh my gosh, what's going on here? And he watches the lady, and sure enough, so he goes up to the lady and he says, please don't think of it rude of me for interrupting, but I'm dying to ask this question. I mean, ma'am, every night you come in here and you order the scallop, but you don't eat it. And I notice you eat everything else around it. And then they take it away, and I'm just curious, why is that? I mean, ma'am, that's the highest, most expensive entree item we have on the entire menu. And she goes, oh, I'm happy to answer that, no problem. She goes, I hate scallops, but I love the garlic coating, so I just put it in my mouth, suck off the coating, and put it back on the plate. And so, true story, you know, and so from that point on, obviously he is no longer thinking, okay, I'm not going to touch this anymore, but things aren't always as they appear, right? So that's what we're going to probably discover here. So tonight I'm going to teach you what I consider to be the best medicine of all, and that is how to maybe not need it, right? Would that be okay with all of you? So we're going to cover some things here. Okay. So these are our 5 or 6 bullet points we're going to hit here tonight. So I came from the military sector, right? In the military, they teach you how to do briefings or talks. And so they say that you tell them what you're going to tell them, and then you tell them, and then you tell them what you told them. Okay, so we're going to kind of follow that format a little bit, make it easy. We're going to talk about what hormones are, what they are and what they're not. We're going to talk about the differences between synthetics and bioidenticals, also known as human identicals. We're going to also discover what the different various delivery systems, the options, how do they get into your body, what are my choices, and then whether or not they can help men and women, and if so, in what ways. What are the risks? We hear people saying, uh-oh, what about these risks? What do I hear about you can catch this or that? We're going to talk about those, and then you're going to decide tonight whether or not you feel that you're a candidate. Okay, so that's kind of our format. All right, to do that, I mentioned this earlier, and this is the way us doctors are trained. You know, Dr. Gary over here and Katie, you know, we're trained in this disease management system. We're taught how to manage diseases, but we're not really taught healthcare. We go into medicine thinking they're going to teach us healthcare, and somewhere along the way we get distracted or sidetracked and we get focused and all enamored with disease management. But we want to, so really our system in America, as much as I like it, it's really not a healthcare system. It's kind of a sick care system, if you follow me. Right? So we need to get back to healthcare, putting healthcare back in the hands of the patient and help them really learn how to prevent diseases. And so our system teaches this. This is conventional medicine. I've been practicing 30 years. I worked my last ER shift 18 months ago. And so I'm thankful to have served in that environment, but I'm spending the majority of my time now teaching other doctors how to do hormone optimization. So this is the system I trained in, prolongation of morbidity, which means here's all of us in the room, we're climbing the curve there till about age 20 or 30 is when we're at our peak, and then after a while we start kind of heading downhill a little bit. And then maybe over here 60, 70, 80, we have these major afflictions hit us, and then our system says, well, we can help you live longer. We can put in that stent, and we can cut out that cancer, and we can give you other things to help you live longer. But what about your quality of life? That quality of life down here is starting to really descend fast. And some people say, you know, I don't want to be around anymore. I might feel bad, but I don't want to live to be in my 80s, 90s, 100s if I got to live with this. So quality of life isn't addressed, but rather we can just help you live longer. So you end up feeling poor, but living longer feeling poor. Does that make sense? That's kind of our system, okay? So we want to get away from that. And there's me, okay? I'm the guy here at the bottom of the cliff, in the ambulance, in the emergency room, dealing with the stuff that rolls in the door, and I'm, you know, catching patients as they fall off the cliff, and I either treat them and admit them to the hospital, or I treat them or street them. I send them home. They can follow up with their family doctor, okay? So what I found the best was to be, how about if we put up a guardrail? How about if we teach people the way that they can no longer fall off the cliff? That's more attractive, right? Retaining their youth and vitality. And so this is from the father of modern medicine. Osler said, you know, the person who takes medicine must recover twice. First from the disease and second from the medication itself, because it has side effects. So this challenge was thrown to us, and this is a Chinese medical text 4,000 years ago. They said superior doctors prevent the disease. Mediocre doctors treat disease before it's evident. Inferior doctors treat full-blown disease. That was the way they chose to do things way back then. Now, tongue-in-cheek, I was the guy in the ER, so I'd never seen the patient before, so in a way I served in that inferior doctor role because I'd never seen them before. I hadn't had a chance to impact them. So I prefer to play in this space now. Let's teach people how to prevent the disease. So this is what we do now. So there's that curve. Get up 10, 20, 30 years of age, and now we want to extend your vitality, extend that quality of life. So when things start dropping off, we catch that and keep that high quality of life so that we can go on out to, okay, we lost our television here. We might need a little help. There it goes. And keep that vitality. For example, about 10 years ago, I'll show you a picture a little bit later. Well, let's just skip on to that. Let's just save that for later. Okay, so what we want to do is not just give you lifespan, we want to give you health span. Now, both of these people are in the 70s, but would you agree there's a dramatic difference taking place, right? Let's restore that which has been lost. So it's a functional medicine approach. Buck alluded to that. So this might be a complex picture, but basically if you think of these little blue circles here, patient comes in, they have depression. Well, conventional medicine says, well, here, let me give you an antidepressant. Okay, well, think about that. Does that, you know, like maybe Prozac or Wellbutrin or something like that, or Zoloft, but does that person really have a Zoloft deficiency? Do they have a Prozac deficiency? Is that their problem? Or do they have hormonal imbalance? They have low thyroid or vitamin D. Are they pre-diabetic? Are there issues leading up to that? So we treat with that, but you don't stop there. Shell back the layers of the onion, look for the root cause, fix that, and then oftentimes you'll reduce or eliminate the need for the fix and the cure. Let's help them get off the antidepressant because they don't need it anymore. Are you following me? Yep. All right. So here's what you need to know. Not all hormone therapies are created equal. Hormone replacement is not a one-size-fits-all approach. It has to be customized. Customization, not generalization. We want it to be unique for every person, all right? Based on their kidney function, their activity level, their age, their blood levels. That all has to be factored into a dose that's right for their body. Then you need somebody who's an expert. They knows what they've been doing. They've been practicing it for a while. They've been trained properly. And then here's probably one of the most important parts of the evening, and that is this concept called optimization, not just normalization. Now, what do I mean by that? So if you get your blood drawn, they report out a result or a value for any given test, and then they package it in a range, okay? It's called the reference range. So here's what the lab does. So the lab in this area, so what's Grand Island, 50,000 people approximately? So the lab for this area probably has all 50,000 people's blood drawn. Their computers compile all that data. They map it out under a bell-shaped curve that establishes the 95% confidence interval. That means that helps them establish the upper border and the lower borders under that curve of the reference range. Okay, that's an average of the general population. The younger folks tend to have higher values. The older folks tend to have lower values. All right, so what happens is I think we all at some point reach a season of our life where we're saying, you know, I don't feel myself anymore. How come I'm tired all the time? How come I got dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, poor libido. I'm not getting any results in the gym. It takes me too long to recover from the gym. My sleep sucks. My joint aches. I got hot flashes. Nice. You want me to keep going? I mean, I will. Some of you are nodding your head. Yeah. Yeah. So so people don't know what to do, and so they just Google it these days. It seems they just Google it, and it might say like, oh hey, go get your thyroid check. So you get your thyroid check, and then there's that curve, and that maybe it lands over here on the lower part of the curve, and then you go into the doctor, or they call you on the phone, and the phone call says something like this: hey Jenny, we got your blood test back. Looks to us like you're in the normal range. That's the words they like to use, right? And you're like, I don't feel normal, what is it? And you're thinking, well, maybe they'd say, well, maybe you're just getting older or something like that. Well, no, we don't do that. We treat it. We move it over to the other part of the curve. In essence, resetting it to where it was 10, 15, 20 years ago when you were at the season of your life and you felt your best. So we call that concept optimization, not normalization. Who wants to be normal, right? Doesn't it seem a little more appealing to be optimal? Because that's really where we were, and it just drifted with time to the point where it created all these symptoms. So that's your effective strategy, okay? So there it is again, optimal, not functionally low, but optimal, where it is, it's right for you when you were at the years of your life and you felt your best. All right, so what are hormones? They're messengers. They just send messages. Has anybody ever heard of insulin for diabetes, right? Common. It's a hormone. It just makes the blood sugar go from the bloodstream into the cell, like a lock and key. It opens the key up, okay? So here's the question. Do we lose our hormones because we age? Or do we age because we lose our hormones? See, I think the latter is true. The aging process accelerates because the hormone levels first start dropping, not the other way around, okay? So people that have abnormal, they might feel like this, but have, quote, normal labs, right? Or do you feel like this? Because now you have optimal labs. Or maybe like this because you don't feel so good, or maybe like this, or maybe you feel like this. Let's see if we can get that to play. I'm going to date myself when I do this. Is that playing? Not playing. Oh, come on. Please. Oh, shoot.
New Jersey writes in and says, "Dear Rosanna Dana, last Thursday I quit smoking. Now I'm depressed, I gained weight, my face broke out, I'm nauseous, I'm constipated, my feet swell, my gums are bleeding, my sinuses are clogged, I got heartburn, I'm cranky, and I have gas. What should I do? Mr. Feder, you sound like a real attractive guy."
I think they probably have a hormone imbalance. That's probably what the guy's really got. Anyhow, so here's the list. I'm not going to read it to you, but look here carefully and ask yourself, do any of those bullet points strike a chord? And if the answer is, yeah, if your joints ache, do you really have a Motrin deficiency, right? No. If your blood pressure's up, do you have a blood pressure pill deficiency? No, there's a root cause of the problem. So we're going to look at all these, okay? Here's the symptoms. How about fatigue? Anybody here in Grand Island ever get tired? Okay, 3 of you. Okay, all right. All right. What do people do when they're tired usually? What's the typical thing to do? Hey, I'm tired, I need to take a nap. What else you do? Need a cup of coffee, right? Or energy drinks. Do you guys sell energy drinks up here? No? Yeah, I mean, I don't know. I don't buy them, so I guess so. So energy drinks, okay, or coffee. Here's what I've learned. When you take a caffeine stimulant, and yes, I use caffeine, and I like it, I am borrowing energy from the future. When I borrow energy from the future, guess what? I have to pay it back. So I have one patient, and I'll never forget this. I go, hey, John, do you ever use energy drinks? He goes, oh yeah, doc, I take one every day at 3:45. I'm like, okay, how come you choose that? Because that gives me time to finish my work, drive home in traffic, and get home and settle before the crash hits. He's timed it because he knows the crash is coming after that. So you have to pay it back. So the symptom checklist. Do we have symptom checklists? Okay. Do we have just the checklist, or are those more of the packets? Okay, there's a packet. Here, I'm going to throw this out at you guys if you can. If we have extra, or can we just get some packet, or just some symptom checklists? We'll pass these out tonight. Fill them out to yourself. That serves as what I call a before picture, all right? Because 80% of our decision to figure out dosage for you goes on how you feel. But the blood work gives us 20%, but not the other way around. See, we're not treating a blood test, we're treating you. And so this is your way of describing or quantifying how you actually feel to yourself. Don't show it to anybody else. Fill it out in private. If you're here with somebody that you know, like, and trust and love, don't reach over and try to change their answers, all right? Fill out your own. We'll hand some of these out. Thank you for doing that. You know, I don't want it to distract you from what we're doing here, but I want you to have that. One side should have a male, the other side should have a female. Okay. We won't create too much ruckus and stuff, but you can look at those, and that's a way we assess. Male and female. Yep. And we'll get you some pens and stuff. And then, so the other thing is we'll attach a number to those. So that's a scoring system. And then what we do, if you decide to do therapy, what we will do in about 4 weeks or maybe 6 weeks perhaps is we're going to repeat that test. We're going to repeat the blood test, and we repeat the symptom checklist. Does that make sense? That way we can track to make sure you're truly getting treated. Okay? We have a success rate that pretty much is about 90% first time. Okay? Right. Okay, so the gentleman up front, I don't know if you were able to hear or not, the gentleman up front says, hey, are you able to repeat that test? I said, yeah. So we do a blood test before, we do a symptom checklist before. And then in about 4 or 5 weeks or so, we repeat the blood test and we repeat the symptom checklist, and we lay them side by side just like this and compare the two. Does that make sense? Again, we're focusing on treating you, not just your blood level. And this is the way we ascertain or score that, okay? Is everybody following that? All right, so here we go. Here's our chart. Sorry, it keeps flashing for some reason. Maybe it'll fix itself in a minute. I don't know what to tell you about that. Maybe that means it wants you to look at it or something. I don't know. Hopefully it don't cause any seizures in anybody, you know. All right. Okay, there's the level. So as the levels start to drop off, we don't want that happening. I don't know what to tell you about this. Wiggle the cord. Or maybe have my IT guy come up here and help me if that needs fixed. Oh, there we go. That was it. Thank you very much. You fixed it. Give that person a prize, whoever said that. Love that. Thank you so much. So there's those levels dropping off, but look, so when they drop off, look how the symptoms show up. But look what's happening if you restore the hormones. Then the things go away and they get better. Okay? That's the whole concept. So here's the BioTE method. Here's the hormones we optimize. Testosterone, estrogen, thyroid, and vitamin D. Vitamin D is a hormone. And yes, we do this in both genders. Okay? But the method also incorporates medical-grade nutraceuticals, which are basically high-end nutritionals that are pharmaceutically produced, but they're non-prescription, but they produce pharmaceutical results even though they're over-the-counter. Okay? So they don't require prescription. But they're very hormone-specific in what they do. They make your hormones work better, and they make them last longer. So let's talk about andropause. Andropause, also known as male menopause. We call that manopause, I guess. So 20% of males over 50 have low T. I actually think it's higher than that. I think it's much more common than that, and I see it happening in earlier ages. I see men coming to me in their mid to late 20s, for example, with a lot of anxiety, and they wonder why. And so what the typical medical approach is, well, let's give you an anti-anxiety pill. Here's some Xanax, here's some CBD, here's something to kind of treat your symptoms. Well, that's fine, but check their testosterone levels. And routinely, I find this happening where they're inappropriately low. I mean, some of these men that I'm talking about in the mid to late 20s, they've got testosterone levels that lower than some of my 50-year-old men and a 25-year-old body. Fix the level, the anxiety goes away. Do you understand that approach? That's that functional medicine approach. So it's a pretty common problem. So testosterone, there it is. provides major symptom relief to breast, bones, brain, heart, and relationships. It's present in both men and women. Okay? So here's a good question. Is testosterone a male hormone? Testosterone a male hormone? He says yes, and the lady says no. I'm sorry, ma'am? Exactly. So testosterone is a male hormone in you and I, but it's a female hormone in her. Love that, right? It's so true. In fact, the ovary makes more testosterone over the life of the ovary than it does estrogen. Wow, I was impressed to learn that. So it's present in both men and women, large amounts of men. Men 30 to 70 lose 1 to 3% per year or more. Women start losing it 15 years before menopause. That means menopause, does any medical people here know the average age of menopause onset across the United States approximately? I'm looking to some of my doctors here. 42, age 42, so if you subtract 15, that means at 27, what happens? They start losing their testosterone. Kind of interesting, okay? So here's the tip of the iceberg. I like this because the male that might come into me saying, hey doc, we need to talk. Things aren't working as well in the bedroom. I need a little help. You got any of those blue pills? Okay. He's treating a symptom. He's looking for relief. We give him that, but then we don't stop there. We look for the root cause. Chances are he's got other things going on. He's gaining weight, blood pressure's crept up, cholesterol's creeping up, blood sugars are creeping up. He has other problems. Look for the root cause of the problem. You can in fact impact his entire life. That's the tip of the iceberg. Remember, the iceberg is only 1/9 above the surface of the water. The 8/9 are below, so there's other issues looming in the background. So here's probably one of the most important charts, I think, of the entire presentation. You're welcome to take pictures of this if you want, but here's what I explain to my patients. I'll say, let me just show you this chart on serum testosterone levels in young men. Okay, think of young men. We got several young men in the audience here tonight. Their levels should be 800, 900, 1,000. All right? What we find is they start losing a few percentage points per year, beginning in their late 20s, early 30s. And when that happens, us men, we gain weight in our midsection and our muscles start to soften, and we don't like it. As it drops below 900, we've now lost the protection against future Alzheimer's. Below 700, we start getting metabolic, which means our gaining weight. Our bones weaken a little bit. Our risk for prostate cancer goes up, not down. In the 400s, down drops our energy, our libido drops. In the upper 300s, our cholesterols are rising, so heart disease increases. Upper 200s, depression, anxiety, PTSD. And then finally, when it gets clear down here, then does the plumbing not work well? That's the last thing to show up while all these other issues are looming in the background. Are you with me? So us men, we not only we need our testosterone. What do we need it for? Our brains, our bones, our heart, our relationships, right? So what this therapy will ramp you right up here, in our case, maybe 1,000-ish for men, and then you're off and running for 4 to 5 months. And here's what's superior. That testosterone, in this case, is released over time, but by cardiac output. It means the more you work out, the higher levels you enjoy. You sit back on the couch, it dials back down. And that's actually how our bodies work. The more we work out, the more blood flow goes by the ovary and the testicle, our levels go higher, and we get better performance. That's what this does. I love that. Okay? So we get questions from time to time. Hey, doc, I heard that maybe if you take testosterone, that could cause prostate cancer. I don't know if that myth has made it up here to Nebraska, but it has to Wichita, where I am. And so this was settled once and for all, and this was published back maybe almost 10 years ago. Dr. Morgan Taylor, Harvard Urology, the leading authority in the world on testosterone, he says there are 19 studies that show there is no increased risk in prostate cancer in men with testosterone therapy. He says actually the opposite is true. Men with low T have higher rates of prostate cancer, and then when they finally present, it's at more advanced stages. Okay? So he's the kind of guy you could go to if you had prostate cancer, and he would insert testosterone pellets in and around your prostate cancer and watch that tumor shrink. Okay, so we have debunked that myth a long time ago. So the positive effects testosterone has in men and women are these. increased energy, zest for life, vitality, better sleep, relief from anxiety and depression, clearance of brain fog, improved memory, focus, libido, and performance. And then we're protecting the breast and the prostate from cancers. We're protecting the bone and the brain and the heart. We're increasing bone strength and muscle strength. We're reducing body fat, lowering cholesterol numbers. Those are the positive benefits of adequate amounts as well as optimal amounts of testosterone. So here's what happens to the cholesterol levels in the blood. We watch all these levels drop. The bad cholesterol numbers head down. The good cholesterol numbers go up. And there's not a prescription drug on the planet that will do all of this, certainly without side effects, which is a wonderful benefit of testosterone optimization. So I'll just throw this up. This is kind of my own personal private medical data. This is called a coronary calcium score. Do you guys have some of this up here? I bet you do. So that means a person could go sit under a CT scanner if they can hold their breath for 10 seconds, and then a quick high ultrafast CT scan will measure the amount of calcium buildup in your coronary heart arteries. And that tells us how much buildup is there. So it's a really good test. They used to be several $100s. Now we can get them in Wichita for as low as 50 bucks. So don't be surprised if you're interested in that kind of test. So I figured, hey, I'm going to go get this done. I've been doing this therapy. I'm interested in my health. You know, I'm not getting any younger. So I went over there and I got down. I got scanned, and my wife got scanned, and I got my calcium score back. Can you read that on the front line? What's your name?
Nick.
Nick, can you read that? What's that calcium score say? It says 0. So I'm like, wow, I'm thankful for that. And then I read on further. It says my coronary age is what? What does it say? Less than 35. Now, I don't know what that means, 29 or 25 or what that means. I'm kind of thankful. My wife's numbers came back equally as well. So I thought, wow. You know, they say in Texas, it's not bragging if you've done it, right? So I'm thankful for that. So that's kind of cool. I sent this to a cardiologist friend of mine who told me about the calcium score, and he goes, oh my gosh. He goes, you need to start smoking cigars, eating ice cream every night. You know, you got all kinds of room. And what that means is my chance of a coronary event, meaning a heart attack, is less than 1 in 10,000 in the upcoming 10 years. Less than 1% in the upcoming 10 years. Wow. Kind of cool, right? Because what's the #1 killer of Americans? Heart attacks. So menopause, ladies, 3,500 women enter it daily. Symptoms begin 15 years earlier. Why? Because that's when the testosterone starts dropping. Women are affected more ways than one, and they don't ever actually get through it or get over it. Since their testosterone drops, their rate of heart disease is 1 in 7. When they lose their ovaries and the estrogen, it jumps up to 1 in 3. So that's also the leading killer of females as well. So estrogen present in both men and women. I didn't know this, but I actually have some estrogen in me. It was pretty important. The body breaks down the testosterone and produces a little bit of estrogen. Estrogen is important. Us men need estrogen. We don't need too much of it. It's what makes us nice. Okay, we need to have some. So if we don't have enough, right? So you hear of weightlifters or people using anabolic steroids. By the way, that's not what we're talking about here tonight. Or testosterone, they use shots, but then their estrogen levels creep up too high. And then when the Hallmark commercials come on and they're welling up with tears, you know, they're taking estrogen blockers to drive their extra estrogen down to 0. What happens is then it gets to 0, then they've lost the nice factor. Now they're out in the streets picking fights with the nuns. So we don't want that happening either. So that's why you hear of roid rage. It's not from high T, it's from low E. Okay? 400 functions in the body for women. Controls hot flashes, makes the skin look nice, feel good, happy. Hormone for the brain, makes the bones and muscles stronger, maintains the memory, helps prevent Alzheimer's and neurodegenerative diseases such as dementias, right? Improving cholesterol numbers and lowering the risk for breast cancer. Hormone therapy, what are the different choices? So there you go. There's synthetics, which are usually pharmaceutical produced. They have little side chains attached to them because they have to be able to patent that. And then there's the bioidenticals, that which is made in the human body. It's bioidentical, human identical. It's exactly what the ovary makes. It's exactly what the testicle makes. Totally identical, okay? And there's different delivery systems, pills, patches, shots, creams, gels, and then, of course, pellets. Let's spend some time on that. So some of you may have heard about 20 years back, a big study that landed. Back in the day, we used to have things like magazines and stuff like that. I know we don't have those anymore. But this hit Time magazine. It was a study. It was horribly done. It was flawed, but they came out with some wrong conclusions on a good segment of that. And it said, hey, if you take hormones, there's a 41% increase in stroke, 29% increase in heart attacks, 26% increase in breast cancer, blood clots, and a big increase in Alzheimer's disease. So everybody says, holy smokes, oh crap. So all the ladies and men quit their hormones. All the doctors started writing hormones because they believed the study. They didn't realize it was flawed, all right, and let people know an alternative. And so this was a compound. In this case, it was called Prempro. Has anybody here heard of Premarin? Premarin. Premarin is from a horse, okay? It's made from horse's urine, pregnant horse's urine. So they call it Premarin, pregnant mare's urine. So that's where that came from. It's a horse estrogen. I don't know a lot of ladies that have horse receptors in them, but that's the pill they use, and it did cause all those cancer. They thought it caused those things. The actual cancer-causing agent was the progestin. It was the part of the pill that was a false progesterone, all right? And so it increased all these risks for cancer, heart disease, and Alzheimer's, plus made them feel horrible. I mean, think about it, ladies. If you got weight gain, vaginal bleeding, headaches, nausea, vomiting, fluid retention, blood clots, that's hard to get a date, right? I mean, you just don't feel right. So we don't want that. So that's from oral therapy. Ingested orally, goes through the liver, causes all these inflammatory problems, and that's not what we're talking about. So the people went to patches. Put the patch on right here, put it on here, somewhere, let it absorb through the skin. There's a problem with that. The adhesive needs to be changed. 45% of the people don't want it to absorb through the skin. See, I think the skin is designed to keep stuff out, not necessarily let stuff in. So it's not the best delivery system. So other people say, well, let's put on some gels and creams. Well, we can do that too. Same problem with the skin, but then it transfers to others. One of my patients called me one day, gentleman, his urologist put him on androgel, which is a gel of testosterone, and he called me in a panic, even though I didn't write it for him. He says, hey, something's up. Can you tell me my 1-year-old boy is starting to grow pubic hair? I'm like, are you on androgel? He goes, yeah, my urologist wrote it. It was rubbing off on his child because he had put it on. So as soon as he gets rid of that, it all goes back to normal. But that's the problem. It can transfer to other people. So people don't like the gels. So this is probably pretty common in the male population. Men who start testosterone, they always heard of the shots, right? So it's cypionate, it's a synthetic, so you get a big spike, and then it wears off, and then you have to reshoot, and then it wears off, and then you have to reshoot, and pretty soon you got this roller coaster going on. And usually a lot of people around them know when it's time for the guy's next shot, even before they do. So it elevates cholesterol and those kind of things. So 99% synthetic, so it creates a problem. So that's where people like the bioidentical hormone pellets. Here's where it gets very interesting. These are natural, plant-derived compounds, okay? They're extracted from the soy plant. There's no soy in it. They just extract the cholesterol ring, and we replicate it out and make the exact molecular structure of what the testicle and what the ovary produces in the form of testosterone. It lasts 4 to 6 months. It's the most widely studied therapy. It's been around 80 years. It allows us to give you a steady stream of hormone in your blood, again, released by cardiac output, individualized dosing, put under the skin. Most people don't even know it's there. In fact, all we do, put a little numbing medicine right here in your upper outer hip, make a little nick, insert the pellet, put a Band-Aid over it. Doesn't even require a stitch, okay? We put you on a restriction for a couple of days to don't exercise that area, and then it starts absorbing, and it rises up and lasts 3 to 4 months in females and 4 to 5 months in males. You only have to do it a few times a year. People say, hey, is this some brand new, newfangled therapy that just got developed? Well, in a way, but it was developed 85 years ago. History's been around a long time. It's been clearly studied. It's been used in multiple continents. It's been used in the U.S. now for the last 20 years. But a lot of us doctors are not trained how to do it unless we go and get advanced certification, like what Katie has done and Dr. Gary has done. So here's the levels. Oh boy, here we go again. Check the connection. See if that works. Here we go, one more time. There we go, fixed it. Okay, so the estradiol levels go up and down. like daily, if you use troches, like the daily pills, you get up and down, up and down. There's the steady state from the implant. There's the patch lasting about 3 days, and you have to put a new patch on, okay? So the BioTE method is based on the right type of hormone. It's not a synthetic. It's bioidentical, human identical. It's the right dosing. It's customized to that person, and the delivery system is superior because it delivers just like the ovary and the testicle delivers it in our own bodies, okay? We call that endocrine mimicry. So there it is, safe and evidence-based, clinically effective, no roller coaster, a couple of times a year, no side effect profile. It's the best way to make the bones stronger. I'll show you that shortly. No evidence whatsoever of increased breast cancer risk. It does not stimulate breast tissue. The largest study in breast cancer ever done on planet Earth was released about 6 months ago. And it found in the largest population, 10,000 patient years, these patients who received testosterone pellets and estrogen pellets had a reduction in the rate of breast cancer, a reduction in the occurrence of breast cancer by almost 40%. Wow, 40%, not 5%. All right, because sometimes I'll get a patient in, hey, it looks like we need to take a look at your hormones, and they may say, oh no, you know, my mother had breast cancer. I don't know, I'm not supposed to take hormones. What she doesn't know is that she's going to get, she thinks that giving her, if she doesn't take hormones, she won't get breast cancer. No, no, no. Opposite is true. Not taking hormones, you get breast cancer at the rate of the rest of the general population. But when you take pellets, your chance of getting it drops 40%. So not doing hormones is much higher risk than doing hormones as it relates to breast cancer, okay? Breast health, there you go. I just kind of covered all that stuff. The pellets don't increase the risk. Yeah, okay, so let's move on. More breast cancer data just showing you that the non-users have higher rates of problems, higher rates of cancers, and higher death rates from all cause by not adequately optimizing their hormones. How about bone health? There you go. That kind of says it all. So traditional therapy, oral therapy, synthetics, things like that, produce improvement of bone, DEXA scans, strengthening and reversing osteoporosis at 1 to 2% per year, over 3 times that with pellet therapy. Better rates in osteoporosis reversal. We reverse it in our clinic. You will be reversing it in your clinic. You will be reversing it in your clinic. You will watch these DEXA scans go from osteoporosis to osteopenic to normal bone density in the course of a short period of time, measured in months or a couple of years, okay? Arthritis, anybody up here know someone with arthritis? 2 of you? Hasn't made it up here yet? Okay, there's some more, all right. Yeah, leading cause, fourth leading cause of disability. Testosterone and estrogen can stimulate pre-cartilage cells, giving people bone and joint relief from the arthritic problems. That's oftentimes what some of my patients report. They say, hey doc, I know it's time for my pellets because my knee's starting to ache again, okay? Because why? Testosterone is a very potent anti-inflammatory. It helps treat all of that. Brain health. Okay, women get Alzheimer's 8 to 1 over men. Women are 50% less likely to develop Alzheimer's disease if they're taking estrogen. Men with low T, 3 times more likely to develop Alzheimer's. Okay, how about heart health? Women and men both, since estrogen makes the heart lipids and everything go down, it lowers your risk for heart disease. Women actually experience a marked reduction in fat when they take testosterone plus estrogen after a couple of years. So it helps the body build lean muscle mass, which is fat building properties. And over a few years, just doing that, you'll actually morph your body. You'll get stronger in muscles, which increases your fat burning power, okay? So what else is important? Thyroid protects against heart disease, brain impairment, fatigue. Basically, thyroid is metabolism and hair, skin, and nails, okay? So we optimize that. That's a simple prescription tablet. Vitamin D, also a prohormone. And then women only, they get progesterone, especially if they have a uterus. And they don't have to have it if they don't have a uterus, but it also makes them calm at night, helps them sleep deeper, that kind of thing. So if you want to live a better life, rather than the Band-Aid approach, this is the way to go. A true focus on healing, not just fixing and curing, okay? So here's the next step, really. If you're experiencing any of the symptoms on your paper, we'll give you time to fill it out later at the end if you want. And that is, I would say just get your blood test. It's that simple. They're even offering you a financial discount incentive to get your blood drawn at any point you want to know. And they'll tell you what that is at the end of the meeting tonight if you don't know. And that is the kind of things that you want to just check. Just get your blood test. Find out what your levels are. Know where your starting levels are. Okay? So the comparison is this. If you do shots with males, by the way, on testosterone, done properly, it's twice per week. So how many weeks in a year? 52. There's your 104 shots a year is testosterone done properly. Okay, that's hard to get excited about that, wanting to stick yourself 104 times a year. Creams is double that. Pellets 3 to 4 times per year, 2 to 3 times per year in males. Potential temporary concerns of first insertions. Okay, so testosterone makes the kidney work better. When that happens, it starts absorbing sodium. Oftentimes, when that happens, you may get the water following it. So people may experience some temporary fluid retention, right? Women have experienced this during their monthly cycles. They get a little puffy, their rings get tight. That's just the testosterone, meaning it's working better. It doesn't happen in everybody. And if that happens, we just give you a little low-dose diuretic and you'll pee it off. That's what happened to me. First time around, I got a little puffy. But I've since had 14 insertions and it's never come back again, okay? So swelling of the hands and feet, the women can get spotting or bleeding because we're giving them back estrogen. If that's the case, we just give you progesterone, take care of it. You could temporarily get some mood swings or some irritability as we readjust your hormones. That's all temporary. If you don't mind your restrictions, you could pop a pellet, and that's easy. We just take it out and put a fresh one in for you. You could get a temporary little bit of acne. Men can experience a temporary reduction in the size of the testicle. So we give you a compound called DIM to get rid of that, okay? Helps block the estrogen, and that's all it is. So here's the key facts. Hormone imbalance can occur in men and women almost at any age, quite frankly. Not all therapies are created equal. It is not a one-size-fits-all approach. You need somebody certified. Normal may not be optimal, right? And so what I would say is just get your blood test. All right, so special guest. Before we go to this, let me just ask you, do you mind coming up, Katie, and just, I know she's to be commended, by the way, her and Dr. Gary. They've decided they're going to put their flagpole in the sand and bring testosterone therapy up to Grand Island because it hasn't really had a qualified, certified provider ever. And so they're just now opening up the light to that. They're going to get their own pellets soon. Mm-hmm. When? Tomorrow. And they've had a patient use it. And so do you mind just sharing what the patient is? And I'll share a video after this.
Yeah.
Come on over here.
I would say we started doing this a lot because of our patients.
I'm
So
going to hold it for you.
I've had patients go out of state and out of town for this therapy for many years, and I didn't know very much about it, and I was very cautious and pretty skeptical. But I just knew they felt better and it worked well for them, and that was it. And then after we opened the clinic here about 6 months ago, I've had a lot of people come up and say, will you please look into this, try to help us. People are tired of traveling, so we started looking into it, and I was a little cautious looking into it, wondering, what's the evidence and really what's the right thing with this. And there was a lot of good evidence to show that it helps. And I have some patients, we've been doing this since October here. And there were a couple people that wanted to maybe share their story tonight, but some other things that happened that didn't allow them to do that. So one lady was going to share her story. She's in menopause. She has the last couple years struggled kind of down this pathway. Somebody that was very healthy, avid exerciser. They developed weight gain, their blood pressure went up, increasing joint pains, all of these symptoms, and then plus the menopause symptoms. So we started some oral medication earlier this year, and that was working well to help a lot of things. She went into pellets, and we talked on the phone today, and she said she feels the pellets are working much better than the orals were for her. She said all of her menopause symptoms are controlled, but she said one of the bigger things was she just felt like her mood was more stable. She didn't feel like she was having the ups and downs like she was having before, and physically feels better. Joint pains are better. She's back to exercising more and doing better. And then Another person shared their story with me that we could talk about tonight too was, this gal's a mom, and she's, you know, younger. She's not in menopause yet, but starting to experience all these symptoms of night sweats and not sleeping and fatigue and no energy when they wake up. And so we had done their pellets, and when they came back about a month and a half later to talk to me and tell me their story, I almost had tears in my eyes because it was life-changing for them. They had gotten to the point where maybe they were tired, not wanting to go out and do things, family events or different things sometimes, and so their energy picked up, they felt good. We actually didn't need to use depression, anxiety medication anymore, and that was something they had been off and on for many years, and it never totally just quite helped enough. And so it changed their, not just how they felt, but changed some of their relationships even, and other people noticed. And it was, I think we as providers, I always think about your health problems, and I don't always think about how your health problems affect your relationships. And that's probably the most important part of your life. And so it's been fun to feel like we have another option to give people to help people.
Great.
So
Thank you
not
for sharing
everybody,
that.
but it helps.
Perfect. Thank you. Thank you for sharing that. All right, we'll wrap up here real quick. All right, so these are just some of my patients. They keep sending me pictures. Some of them, it's kind of crazy. So increased energy levels, restored interest in life, better libido, performance, relief from anxiety and depression, improvements in, mental clarity and focus, better capacity to get in shape, reduced body fat. These are just some more. My patients send me texts, they send me pictures, and so they know it's fair game that if they send it to me, I can put it up somewhere on a slide. So they do that, and yeah, so anyhow, let me just share this video with you. I think it'll kind of drive it all home for you.
Some of the symptoms that I was experiencing were some hot flashes during the day, night sweats.
I was tired all the time. Low libido, just kind of felt like I was a slug. I wasn't even interested in intimacy with my husband.
My moods were horrible.
Fatigue, lack of energy, not sleeping well at night.
I was grumpy all the time. I just had no joy.
Low energy level, sometimes confusion, just not thinking real clear early in the mornings.
I didn't feel like I was myself.
I thought it was just part of that my hormones could be out of whack.
They tested me for pituitary tumors and all kinds of things, and I asked, can you just check my hormones? And that's when they found out that I wasn't making any estrogen.
I had a friend who told me about BioTE and what it did. The radio stations promoting BioTE Medical, and it all sort of converged at the perfect time for me.
I loved the idea that it was natural. I loved the idea that it wasn't something I had to remember to rub on my skin or take orally or whatever I needed to do.
I tried every hormone under the sun before BioTE.
Being in radio, it's stressful. There's always things happening. You've got to be reacting really quickly. And for me, for a while, that was kind of difficult. And then I figured out, okay, it's my hormone imbalance. We got that corrected with BioTE. And since then, I feel like I'm raring to go every day.
I found really the results to be pretty immediate. And I think even some of the things I wasn't even aware of, I found a little bit more mental clarity. I didn't realize I was foggy until the fog kind of cleared.
I finally just looked back after a few days once they kicked in, and thought I really feel good, and I feel like I want to run, and I've never in my life ran.
I'm type 2 diabetic, and since I've been pelleted, I've been able to come off one of my 2 diabetic medications. I've stopped using my antidepressant drug that I've been on for years, and I've also been able to get off of my cholesterol lowering medication.
First thing I noticed for me when I knew something was different was I was doing the dishes at about 8 o'clock at night one night, and my wife looked at me and said, "Why are you doing the dishes?" And I said, "I don't know. I just can't stop doing them. I just feel like I can get stuff done."
I was excited to be able to keep up with my kids and my family and the life that I love.
I feel confident and I feel excited about living.
Being able to just be spontaneous, asset to our marriage.
It just feels like I'm a newlywed again.
At the beginning of the program, I was engaged, but now I'm married, and my husband even tells me that he didn't realize that it could get better, that I feel like I'm able to give him a better of myself, that I didn't even know that was missing.
Now, my husband is pleased that my libido has come back, that I've got my energy, and my kiddo is thrilled that I can run around with him.
Teachers and dean of students that ask me, you know, Lisa, and it's BioTE.
I recommend BioTE to everybody who talks about hormones, who's out there wondering what's wrong with them. Go for the optimized levels, and the way to do that is go to biotemedical.com like I did.
I would like to thank BioTE for changing my life.
For helping me to get my life back.
For giving me a portion of my life back that I didn't even know I had lost.
For what it's given me back, a healthier, happier life, more energy. My husband has his wife back, my kids have their mom back.
I want to thank BioTE for helping me age healthier and live happier over the next several years of my life. I'm really excited about what's to come.
Yeah, that's pretty typical examples. I've got patients, again, that send me pictures. This is one of our CrossFitters. This is a 65-year-old guy that I first met. The first time I met him, I had a heart attack on my boat. And so we rushed him to the ER. 9 months later, after fixing him up, he has that remarkable thing. This was my 50-some-year-old dad bod before I really started things. And so 12 weeks later, I just did diet exercise. That's just 2 days a week in the gym, just clean eating. And then my hormones were low, so I optimized those. So that's 179 pounds. That's 159. That's 179. And now I'm about $185. So I'm CrossFitting a couple days a week. My trainer says I'm the oldest guy in the gym. And I went to my first competition this past weekend. And I just wanted to observe it, right? I didn't know if I was going to participate. And he says, Doc, you'll be in the Masters division. I'm like, what are that age group? He goes, well, it's like 35 to 45 plus. I said, do you have like a senior Masters division? I think I'd have to be in something a little later than that. So my daughter joked to me one day and said, Dad, you've gone from dad bod to dat bod. And I thought, oh my God, I got to leave that. So we'll leave that alone. So core nutraceuticals, these are the things, again, that make your pellets work better, and they last longer, and you get more value out of them. So that's really what I kind of wanted to share with you. I want to just take a minute and field any general questions. I don't want to pry with anybody. If you have a personal private medical question, this is not the forum to share that. You can come and ask us off to the side later. But if you have a general question that you think the rest of the audience might benefit from asking, now would be a good time to do that, and we'll just air that real quickly. And if not, we can certainly wrap up and get you guys on your way for tonight. So any general questions for the group? It's okay if you want to ask them. You don't have to ask anything. You can ask something. Yes, sir.
So what's the reason that people are having, what's the cause of low testosterone or low hormone?
Great question. He says, why are we seeing lower testosterone users? So we think a lot of it is environment. We think it's diet. Things that happen in certain individuals. I know for like some of my males, the men who shouldn't have those low levels, oftentimes if they've ever suffered a head injury, a concussion, if they've ever been knocked out or whatever, that starts with the pituitary and that affects downstream hormones from there. If anybody's ever used pain medication because they had an illness or a surgery or they've been on pain medicine long term, that pushes down the androgens and the testosterone. So there's some reasons for that. But largely in the general population, it's diet and foods and things like that. Does that help?
Yeah.
Yeah.
So like if you address those things, can you bring it back up without?
So the question is, can it be brought back? We find that that's possible, but only to a limited extent. So again, if you have a concussion and the pituitary is the cause, it's only going to produce what it is produces. So you're not going to be able to get that optimized without the testosterone therapy in that example. Yes, ma'am.
Is that internationally, or how is that? How do we compare with other nations like Europe and the US? Is it just an American phenomenon?
I don't know that it's limited to just a U.S. population. So I think the founders of BioTE, I know Dr. Donovitz, who's probably been practicing a little over longer than I have, about 35 years. She's been doing hormone optimization therapy for the better part of 20 years plus, and I'm sure he's been doing pellets for at least 15 of those. So that's all U.S. based, but pellet therapy, remember, is in 5 continents. So that therapy has been used in those, so I don't know if they've studied concepts like optimization, but my general thinking is as a whole, as a globe, with environmental pollutants and toxins and soils changing, it's probably affected everybody. Yeah, great question.
So you still have the same effects if you didn't exercise?
Would you say it had the same effects? Oh no, your levels will be even much lower. Okay, yeah. Any other ones? Okay, great. Yes, ma'am.
Do you recommend people, eliminate sugar and other processed foods
Sure.
from their diet with the pellets, or
It's not required, but what you'll find is that people, they have a lot more self-control. I had a lady just the other day. She goes, I can tell my pellets wear off because I start eating more. I'm like, really, what do you mean? She goes, yeah, I start craving sugars and Cinnabons and apple pie and candies. And then when I get my pellets, it helps. So what happens is it has a glycemic improvement. And so her cravings for sugars go away when she's on pellets. You don't have to do it, but you can do it. It would. Oh, sure. Yeah, but you're still going to do well with the pellets, but it gives you the power to do the other things. And what pellets are going to do is it's going to make you feel better. So a lot of us may come home and say, man, I just had a full day at work. I don't feel like going to the gym. I know I should exercise, but I don't feel like exercising. Well, with pellets, you're going to feel like exercising. So what I tell my patients is when you get that feeling, like you want to go out and work out, act on that feeling, right? Don't lie down until the feeling goes away. Get out there. Start walking if you haven't, so that's really what will happen. All right, so think about it this. In essence, what we're doing is restoring your levels back to where they were 10, 15, 20 years ago, perhaps when you were at the season of your life and you felt your best. All right? So, what's your name in the back, sir? I don't mean to pick on you. What's your name?
Me?
Yes, sir.
Jeremy.
Jeremy. So, Jeremy, in essence, what we would be doing with this therapy is giving you back your own testicle of what you had at age 18 and putting it right here. Would that be okay with you? He's nodding his head yes, right?
That'd be a pretty big pellet.
Okay. And that can turn into that, and she's over there waving herself, thinking, okay. All right, so that can happen. But so I want to thank all of you for coming tonight. Let me just invite up Katie, and come on up and share something. Yep. Yeah. Breast cancer, okay.
What is an option if somebody who has had breast cancer, is this a therapy that they could do, or what would that therapy look like for them?
Right, so they want to get their breast, if they have a breast tumor or a breast cancer, they need to get definitive therapy with the appropriate treatment professionals, oncologists, perhaps surgeons, whatever needs to be done.
No radiation.
Whatever needs to be done, we don't fight all of that. And then, yes, you're eligible to get pellets. Now, we won't give you estrogen, even though we know estrogen does not cause cancer because the climate out there, there's a lot of the oncologists now know that. But we give you testosterone only, and that's okay because that's the key thing that helps prevent the recurrence of that cancer. So, yeah, they can get that. Not to mention, it's helping the whole rest of your body. Yep.
And then to Neal's point, we give testosterone. We also have a special testosterone that we use just for breast cancer survivors.
Yep.
And it has a natrazole already in it. That's an aromatase inhibitor, so it blocks that conversion of testosterone to estrogen. So those are special. We kind of order those case by case as we need them. We're always going to err on the side of caution. There's certain cancers that we've got some of our experts that we can kind of go down that path. If somebody was to just beg Katie, we'll get them with one of our cancer specialists that deal with that. And there's certain things we can do depending on the type of cancer that the patient has, right? And so that's not your general run of the mill. So on a high level, what Katie's asking is if the patient had breast cancer, yeah, they can, right? And it's not a family history, it's personal breast cancer. And so just for instance, my wife has some family members that had it. We had her tested and she's positive for 2 of the high risk genes, right? And so all that does is allow her insurance to allow her additional breast cancer testing. So she's going to stay on pellet consistently, right? Because it's reducing her risk, and instead of if her hormone levels were to fall, she could be more susceptible because she is in a high risk category because she carries a couple of those genes.
Great. You're welcome. Great question. Anyone else? Okay. Hey, wrap us up here. Would you tell us what the benefits of being here tonight are, and then if those extend to anyone else? So let's finish off the recording. Any other questions? We'll end the recording, and then